Now that we know about the different types of memory, let's look into factors that impact our ability to remember information. After a brain injury, people can experience two different types of memory loss: retrograde amnesia or anterior grade amnesia. Retrograde amnesia means that you have forgotten things that happened before the collision. For some people, they have a hard time remembering events that happened within a minute or a few seconds just before the injury. For other people, they can lose up to hours before the collision. However, in this case, as people get better, their long-term memories tend to return, but they do so like pieces of a jigsaw puzzle. They come back in bits and pieces and return in random order. Generally speaking, the smaller degree of retrograde amnesia, the less significant the head injury. Most often, my clients have difficulties with anterior grade amnesia, which means they have trouble remembering events that have happened since the brain injury. A good part of this is due to the brain injury itself. Complex systems in the brain are injured, the chemical balance of the brain is upset. As the brain chemistry normalizes, swelling goes down, and brain systems begin working, your memory also starts to work. In my Cognitive Communication Disorders, a simplified overview video, I compare information coming in, like giving it to your librarian, who then takes the book and puts it where it's supposed to go in its bookshelf. That has to do with effectively storing incoming information. When we absorb new information, it flows through the middle of our brain and branches out like a tree. Before information goes to different areas, it goes through that channeling filtering system, which I call the librarian. Another metaphor could be that it's like a mailbox. This goes here, and this goes here, and this goes there. When the brain is injured, the middle areas of your brain gets pressed upon because of swelling. It becomes much more difficult for clients to keep up with information that is rapidly presented, and your poor turtle brain is working too slowly, so all that information is like trying to get in through a funnel and there's overflow. Another issue happens when information is not being sent to the right place. So my metaphor of the librarian just grabbing any books she can and just hucking them behind her in a pile. So all of that has to do with storage challenges after a brain injury. The next issue is retrieval. This is where our retrieval robot comes in. You know, when you're trying to tell someone about a movie or you recognize an actor but you can't find the name of them for the life of you, that is commonly known as a tip of the tongue sensation. You know what it is you want to say, you just can't find it and get it out. Several minutes later, it may just come to you. What impacts this? Why is it that some days it's easier to find what you want to say and other days it's more challenging? We're going to look into factors that impact memory, fatigue, and sleep. Consult your occupational therapist for appropriate sleep hygiene strategies. In speech language pathology sessions, I review sleep hygiene strategies and help clients problem solve and troubleshoot what's working well, what's not working so hot, what can we do to improve it, because if we don't get adequate sleep, it's going to be that much more difficult to think and communicate effectively. You also want to be strategic about what times of the day you feel you're most alert. For most people after a brain injury, that tends to be in the morning before they've spent too many activity points. See my activity points diet video for details. By the time they get to the end of the day, they're likely overstimulated and exhausted and not in a great brain space to be learning anything. Your poor librarian is exhausted, so she doesn't want to make the trips and do all that work to organize information. And then your poor retrieval robot, he's also tired, so he's not as fast at finding the information you want to use. In my Cognitive Communication Disorders, a simplified overview video, we have reviewed how heightened emotions can get you stuck in emotion brain, and it makes it that much more challenging to access your higher level thinking, reasoning, cognitive communication processes. Being depressed, stressed, or anxious can make it really challenging to focus on information, ignore distractions, and process it effectively. This is why eyewitness accounts are not so reliable, because say you've witnessed a bank robbery and there are guns flying, all that stress, anxiety, and confusion is going to spike you in your emotion brain, and your ability to actually pay attention to and absorb details accurately is not so hot, which is why you can get so many different eyewitness accounts of people who have watched the same thing, but they're remembering different details. On top of that, being mad, afraid, or anxious will alter your memories. You can't always control your memories, but there are things we can do to strengthen your skills when you are relaxed so that it's easier to implement those skills in situations when you do have high stress. You are also encouraged to bring an emotional support person to be an extra set of ears, eyes, and brains to help you recall important information, like if you have to go to a doctor's office or a legal appointment. Did you know that some medications can impact memory? You may want to go through side effects with your doctor and determine if there are any reasonable alternatives or ways to mitigate the memory challenges. Alcohol, tobacco, smoking, or drug use also impacts your ability to recall information. Smoking harms the memory by reducing the amount of oxygen that gets to the brain. If you have seen my video, What to Eat to Maximize Your Cognition, you will already know why nutrition is so important for your cognitive processes. Cars need fuel to go, our brain needs fuel to heal and work effectively. Traumatic brain injury or stroke both actually cause damage to the organ responsible for remembering things, your brain. A head injury can cause both short-term and long-term memory loss, and memory may gradually improve over time. A stroke stops blood supply to the brain and can often cause short-term memory loss. So a person with a stroke may be able to recall childhood events but be unable to remember what they had for lunch that day. Understanding the factors that impact memory help us feel more in control because we can anticipate these factors and address them in advance, particularly before high-stakes conversations or situations. Take good care of yourself and stay tuned for internal and external memory strategies to help you in everyday tasks.